Welcome back to Have More Babies. Today, we're getting into something really practical, something every parent deals with. Kids' medications.
Yeah, it can feel a bit overwhelming sometimes, can't it?
Definitely. So we're going to break down the key things you need to know using insights from the folks at Omega Pediatrics. They're a great practice over in Roswell, Alpharetta, and Milton here in Georgia.
Right, this comes from their article, Pediatric Medications, What Every Parent Should Know.
And our goal here really is just to help you feel a bit more confident, more informed when you need to give your child medicine.
Absolutely. Knowledge is power, especially here. So where should we start? I think the most crucial point is always talk to your pediatrician.
That's the absolute foundation, isn't it? Like if you have any question, even a small one about a medicine or you're worried about something.
Just call them or make an appointment. It's always the safest bet.
And it follows that you should only be giving medicine that your pediatrician has actually recommended for your child for that situation.
Exactly. Don't just grab something because it worked last time or for another child. Needs change.
It's especially true for those over-the-counter cough and cold meds, right? I know we hear this a lot, but it's worth repeating.
Oh, definitely. For kids under 6, you really shouldn't be giving those unless a doctor specifically says to.
And for the really little ones, under 2.
Omega Pediatrics is quite clear those meds are generally just not appropriate for babies and toddlers that young. The risks often outweigh any potential unproven benefits.
Okay, good reminder. Now, something else that trips parents up, combination medicines.
Ah, yes. The ones that promise to tackle, you know, cough, cold, and pain all in one bottle.
Sounds convenient, but what's the catch?
Well, the tricky part is they often contain a pain reliever, like acetaminophen or ibuprofen.
Right, so if you're giving that and then maybe later you think they need something for pain or fever.
You could easily give them too much of that pain reliever without realizing it, double dosing.
Yikes. So the advice is,
Stick to single-ingredient medicines whenever possible. Treat the symptom you're most concerned about. If it's a cough, use a cough medicine, if appropriate for the age and advised by the doc. If it's pain, use a pain reliever. Don't mix,
makes sense. Keep it simple.
especially for kids under 6. Omega Pediatrics really advises steering clear of those multi-symptom formulas for the younger crowd. It just gets too complicated to dose safely.
Okay, what about fevers? That's a big one for parents. When do we actually need to treat it with medicine?
Well, medicine can definitely help if the fever is very high or if your child is clearly uncomfortable, really miserable. So it's
More about comfort.
primarily, yes. It's good to remember that a fever itself isn't usually dangerous. It's actually often a sign the body's doing its job, fighting off whatever bug they have.
That's a helpful perspective. We're treating the discomfort, not necessarily attacking the fever itself as the enemy.
Exactly. Making them feel better while their body works.
Now let's talk about the risks.
Yeah,
Because mistakes can happen.
they can. And the consequences can be serious. Omega Pediatrics points out a really sobering statistic. Thousands of kids under 5 end up in the ER each year because of medication errors.
Wow. That really underscores how important this is. It's not just what you give, but how you give it.
Precisely. For medicine to work safely and effectively, getting the administration right is key. And kind of related to that, never ever leave medicines where kids can get to them.
Right. Keep them locked up or high up. Unsupervised access is a huge risk.
Their curiosity is natural, but it can lead to accidental poisoning very quickly.
Okay, so we're calling the doctor. We're being careful with OTC meds. Let's say we need to buy something. What should we look for at the pharmacy?
First thing, always double check the name, especially the generic name. Make sure it matches exactly what the doctor prescribed or what you intended to get.
And read that label before you even leave the store, maybe.
Ideally, yes. Or at least before you give the first dose. Read everything, the ingredients, what it's for, and crucially, the age appropriateness. Is this actually for your child's age group?
What else on the packaging?
Check the safety seal, make sure it's not broken.
Mm.
Look at the bottle itself. Is it intact? Is the label clear, not smudged or tampered with? And always check the expiration date.
Good point. And Omega Pediatrics actually suggests trying to get one that's not too close to expiring, right?
Yeah, if you have a choice, one closer to its production date is generally better, fresher, likely more effective.
And meds come in different forms for kids. Drops, liquids, chewables.
Right. Generally, you've got concentrated drops, often for infants, maybe up to 2 years old. Then syrups or liquids are common for toddlers and younger kids. Chewable tablets are usually for older kids who can handle them safely without choking.
Think about what your child can actually manage.
Exactly. And most liquid meds come with their own measuring tool, like a little cup or a special spoon.
What if it's missing? Can I just use a spoon from the kitchen?
Please don't. Kitchen spoons are not accurate at all. If the tool is missing, ask the pharmacist. They can usually provide one like a dosing spoon or an oral syringe.
And those infant drops, the concentrated one.
They usually come with a specific syringe or dropper, again, for accurate measurement. These are marked in milliliters, ml, which is the standard.
Okay, so you've got the right medicine, right form, right measuring tool. Now, the crucial part, giving the dose.
Rule number 1, dose and strength must match your child's age. And often their weight is even better if you know it. Never guess.
And remind us about the concentration difference.
So important. Infant drops are much more concentrated than children's syrup. You cannot just swap them, giving the same volume. A tiny bit of drops is equivalent to a much larger amount of syrup.
Big difference. And always use the tool it came with.
Yes. Use the syringe, dropper, or cup provided. No improvising with kitchenware.
We mentioned avoiding combination meds, especially for the under 6 crowd.
Yes. Worth repeating. Keep it simple. Target the main symptom, and definitely avoid multi-symptom products for young children unless your doctor specifically directs it.
And the absolute bottom line when giving the dose.
Never give more than the label or your doctor says. Follow instructions precisely. If you have any question, any doubt about the dose, how often, potential side effects, just call the doctor's office. That's what they're there for.
Absolutely. And another non-negotiable. Never give adult medicine to a child.
Never. Their bodies are different. They metabolize drugs differently. What's safe for you could be dangerous for them.
And if the worst happens, if you think they took too much.
Call poison control immediately. Don't wait. Have the bottle handy if you can.
Okay. What about storing these medicines safely at home?
Keep everything, the medicine bottles, the dosing tools, way out of reach and sight of children. High up, locked away if possible.
Even things you don't use often, like allergy medicine.
Especially those. Make checking expiration dates a regular habit. Maybe set a reminder twice a year. Expired meds might not work or could even be harmful.
And general storage tips.
Room temperature is usually best. Keep them away from heat, direct sunlight, and moisture, so the bathroom cabinet is often not the best spot because of steam.
Right. And get rid of old or expired stuff properly. Don't just toss it in the trash where a child or pet could find it. Ask your pharmacist about take-back programs.
Good advice.
Okay, let's talk about some common scenarios. Fever and pain. What are the usual suspects?
Acetaminophen and ibuprofen are the main ones parents reach for. They reduce fever, help with general aches and pains, even things like teething discomfort or post-vaccine soreness.
Let's break down acetaminophen first. What do we need to know?
Its main job is fever and pain relief. A key thing is it's in lots of other over-the-counter products, especially cold meds. So you have to check labels carefully to avoid accidentally giving too much.
What's the usual kid's strength?
The standard liquid or chewable is typically 160 milligrams per dose unit, like per 5 millimollar or per tablet. It also comes in suppository form.
How often can you give it?
Generally every 4 to 6 hours as needed, but the absolute maximum is 4 doses in any 24-hour period. There are also junior strength tablets like 80 milligrams or 160 milligrams that dissolve, but never give kids the adult 650 milligram extended release versions.
And a caution for the very youngest.
Yes, for babies under 3 months old, don't give acetaminophen without talking to your pediatrician first. They need to weigh in.
Got it. Now, ibuprofen.
Ibuprofen works similarly for fever and pain. The timing's a bit different. You usually give it every 6 to 8 hours.
Norms.
It also comes in infant drops, children's liquid or syrup, and chewable tablets. Same rules apply. Correct dose for weight and age is critical.
And a really important warning about aspirin.
Yes, absolutely critical. Unless a pediatrician specifically tells you to give aspirin for a particular reason, which is rare, do not give it to children or teenagers for fever or pain. There's a risk of Ray's syndrome, a serious illness that can affect the brain and liver.
Okay, very important. What about colds and coughs? We said avoid OTC meds for the little ones.
Right. The American Academy of Pediatrics recommendation, which Omega Pediatrics highlights, is basically that these meds don't really work well for young kids and can sometimes cause side effects.
So what can parents do to help a miserable, stuffy kid?
Focus on comfort. Saline nasal drops or spray can help loosen mucus. For babies, you can gently suction out their nose with a bulb syringe after using saline. That can make a big difference for breathing and feeding.
Just helping them clear things out naturally?
Exactly. Humidifiers can sometimes help too. And lots of fluids, rest.
Okay. What about allergies? Itchy eyes, runny nose, hives.
Antihistamines are the usual go-to for those classic allergy symptoms: sneezing, itching, runny nose. They can also help calm itching from things like chickenpox or bug bites.
And for itchy skin itself, like eczema or poison
A
ivy?
hydrocortisone cream or ointment, usually a low percentage available over the counter, can provide relief for localized itching and inflammation.
It's helpful knowing these categories. Now, stepping back a bit, how does the pediatrician figure out the right treatment path in the first place?
It's a process. It starts with them really listening to you, getting the details about your child's symptoms. When did it start? What have you noticed? What have you tried already? Your input is crucial.
So being a good observer helps.
Tremendously. Then they consider what's best for your specific child. Not just the illness, but the child as a whole, their age, their history, maybe even things like how easy or hard it might be for them to take a certain kind of medicine.
It sounds very individualized.
It is. And Omega Pediatrics really emphasizes that they see it as a team effort with parents. They respect that you know your child best. If there are different options, they'll often discuss them with you, consider your preferences. It's collaborative.
That's reassuring. And then there's the physical exam.
Of course, they'll do a thorough checkup, listen to the heart and lungs, check vital signs. Depending on the situation, they might need more info from lab tests, like a blood draw or urine sample.
Sometimes even more involved tests.
For more serious concerns, yes. Things like x-rays or maybe even scans like an MRI or CT, or heart tests like an ECG might be needed to get a clearer picture. But that's usually for more complex cases.
So the plan is really tailored.
Absolutely. Two kids with a cough might get very different advice based on everything else going on. And for older kids, maybe 7 or so and up, the pediatrician might even involve them a bit in the decision-making, explaining things to them, maybe asking about their preferences if there are choices.
That's great. Okay, let's circle back to giving liquid medicine. We know accuracy is key.
Super key. Since kids often can't swallow pills, liquids are common. But you have to be careful with measuring.
The article mentioned the drug facts label on OTC meds.
Yes, that's standard now. It tells you what the medicine treats, how much to give based on weight or age age if you don't know the exact weight, and importantly, warnings like do not use for certain age groups, often under 6, for cold meds.
And prescription liquids?
Similar label info, but it's prescribed just for your child. Read it carefully. If anything is unclear, call the doctor or pharmacist. Don't guess.
Let's quickly recap the measuring tools again.
Okay. Most doses are an ml. Remember, 5 millivels is about a teaspoon, 15 millivels a tablespoon. But don't use actual spoons. Use the cup or spoon that comes with it. They have marked lines. For small doses, under 5 milliml, syringes or droppers are best. They're the most accurate, often marked in fractions of mLs.
And you had a tip for giving it to babies?
Right. With a syringe or dropper, aim towards the inside of their cheek, not straight back down the throat. It helps them swallow and reduces spitting it out.
Smart tip. Now, side effects. What should parents be watching for?
Any medicine can potentially cause side effects or adverse effects. They show up as symptoms. Common things might be stomach upset, diarrhea, or constipation, maybe a dry mouth, or even little sores.
Skin reactions?
Yeah, rashes, eczema, flare-ups, general itchiness, unusual spots, sometimes excessive sweating or the opposite, feeling cold.
Behavioral changes?
Can happen. Unusual drowsiness or sometimes hyperactivity, dizziness, maybe even palpitations, or feeling like their heart is racing.
And kids react differently, right?
Absolutely. One child might get sleepy from an antihistamine, another might get wired.
Yeah.
If you see anything that concerns you, anything alarming or just doesn't seem right after starting a new medicine, you need to tell your pediatrician.
Don't just wait and see.
Not if you're worried. Call them. They need to know.
Yeah.
They might tell you to stop the medicine or prescribe something else, maybe change the dose, or try a different brand or form.
Sometimes it might need more investigation.
In serious cases, yes. They might need to run more tests or refer you to a specialist.
So communication is vital throughout.
Crucial. Tell the doctor everything else your child is taking, prescriptions, OTCs, vitamins, supplements, and keep track of how the medicine is working or not working and any side effects you notice. That info helps them make the best decisions.
This has been incredibly informative. It really highlights the approach Omega Pediatrics takes.
Yeah, their whole philosophy, based on the article, seems centered on working closely with parents, respecting them as the experts on their own child, and collaborating to give the best care. They want healthy kids, happy families.
And if people want to dig deeper into this or find out more about Omega Pediatrics?
Definitely check out their website. It's omegapediatrics.com. They have a lot more detailed information there about all sorts of pediatric health topics, including medications.
That's omegapediatrics.com, a really valuable resource. It just feels better having this kind of knowledge, doesn't it?
It really does. Being informed and careful when giving medications is such a fundamental part of keeping kids safe and healthy.
Well, thank you so much for walking us through all of this today on Have More Babies.
It was my pleasure. Important topic.
And thank you all for listening. We hope this deep dive was helpful. If you found value in it, please do us a favor, hit that like button, subscribe to the channel so you don't miss future discussions, and maybe share this video with another parent you know.
Yeah, spread the knowledge.
And don't forget to check out omegapediatrics.com for more great info. Until next time on Have More Babies, take care and goodbye.
Bye, everyone.